Welcome to our Getting Science Back to Sea workshop. This is notionally an internal workshop, although we potentially have some external guests that have joined us from Northeast Fisheries, from the U.S. Geological Survey, from BIOS in Bermuda, Scripps, and URI. So welcome to those who've allowed inside the tent to hear our internal workshop. A little bit of a background, Hui Marine Operations has been working on the problem of getting our fleet back into operation under this current pandemic, and have successfully been able to sail the Atlantis from Hui to the state of Washington for its midlife. And in the course of doing so, have learned an awful lot about what needs to be done in order to get the ships to sea safely. In the midst of planning a trip for the Armstrong, which notionally will sail on the 7th, so that plan is well along and in the process of being implemented. In fact, we're going to be presenting that plan to our sponsors this afternoon at 4 o'clock for a final sort of review. And we're also developing plans for the Armstrong to go further afield than the Pioneer Array late in June and through the summer, so to the North Atlantic. So these are all providing us opportunities to learn about how to plan and what to do to make sure that we've managed to assess the risk, manage the risks, and really focus on the safety of everybody aboard. And so what we thought we'd do today is share some of what we've learned in the course of that process, and Sarah's going to be our main speaker. The idea really is to help to folks that are interested, scientists and other folks that are going to be hoping to get back to sea here soon on any ship, across the academic fleet. What types of things we've learned in the course of getting our ships back to sea? What questions you might want to ask of the institutions whose ships you might be sailing on, and also to provide a little bit of a baseline about the types of things that we're finding acceptable and reasonable to do, and when you confront those things or similar things with other institutions' operations, you'll have a sense of how they match up to what we're doing. We're not intending to be prescriptive here today. Each situation is quite unique, and we've certainly learned that in the case of each operation that we've tried to plan for our own ships. So each experience that you individuals would have going on whatever ship will have its own unique attributes. This idea kind of came about from an ask from John Collins in the OBS lab and some of his colleagues there, and Rob Evans, the chair of G&G. So thanks for that initiative. Dan Finari also weighed in with asking some questions that we thought this workshop would help to answer, and hopefully the types of things we'll be talking about will be applicable to all the science disciplines and engineering, as well as the techs that go to sea. So from a format perspective, Sarah's going to give a presentation. We did get 15 or 20 questions put in through the web that we've got some answers ready for, which we'll hopefully get to. And then if we have a little time left, we'll take some of the live questions that you guys might present. We've had a big team working on this, so Sarah is the pointy end of this, but a lot of folks from marine operations. In fact, we've been having 3 times a week calls on this whole response to the COVID crisis pandemic, and that has really helped us to crystallize our thinking. And outside of marine operations, a lot of help from Kathy Benjamin from HR, Chris Land, our chief counsel, Ron Reif, our safety officer. And we've worked really closely with our science colleagues for the Pioneer Array planning and gotten a lot of great insights from them, Al Pluterman and Derek Buffett in particular. So anyhow, I'm going to turn it over to Sarah to get started. Thanks everybody for joining.
All right. Well, thank you, Rob. And thanks everyone for joining us. So as Rob said, I am Sarah Fuller. I'm Hui's Research Vessel Science Coordinator. And together with all of the stakeholders that Rob just mentioned, we've put together this presentation for you using resources from various institutions as well as the UNOLS guidelines. The overall purpose, as Rob mentioned, is to help get you all back to sea on any vessel. So in the course of this presentation, we'll be discussing the following topics. So risk assessment methodology, categories to consider, analysis, And then cruise planning considerations. So things like your mobilization and demobilization, your science party and equipment preparation, safety at sea, and vessel operation management plans. Then we'll round out the presentation with some case studies and touch on UNO's scheduling for 2020 and 2021. Overall, a big lesson learned is that planning successful cruises these days is not a mechanical process. A human approach with clear communication will work greatly to your advantage. So how you frame your risk assessment process will be the starting point for making a unified plan. This will help you reconcile if there are any differences between policies or protocols between institutions by getting you to the base of what the risks are and their different potential mitigation methods. So any risk assessment methodology that you choose to follow should include the following elements. First, you need to clearly identify the risks that you want to assess. This should include all considerations for the science party, science objectives, as well as details pertaining to the vessel you're sailing on and your host institution. You'll want to start a living document where others can provide input about your potential risk categories, which will help you socialize your process amongst your team. You'll also want to form a knowledgeable working group to discuss these risks. Background diversity in the working group is pretty essential to properly identifying the different types of risks as well as different mitigation methods. So you'll want to include folks not only in your science party, but also the vessel operators and any outside set of eyes that could add value to your decision making. Perhaps somebody from HR or from a more senior administration. Then within the working group, you're going to discuss all of these risks, identify your resources that can help define them and offer potential solutions. So readily available resources include those that are listed here, but are certainly not exclusive to what you see here. Then once all the risks are identified, you'll develop mitigation steps with the point of reducing the likelihood or the consequence severity of each of those risks. Then once all of that has been very thoroughly vetted, you should be in a good space to present a final determination on whether or not you feel your cruise can sail successfully and safely. As per the UNOL's guidelines, the decision to go to sea should be unanimous between the chief scientist and the vessel operator and master. If it's not unanimous, then the group should default to the most conservative approach. So if you've ever done risk analysis, you'll know that there are many, many different ways to approach it. However, again, the end goal is always the same. You want to determine how risks can be avoided or mitigated using different actions. If successful, then those actions can help make it safer to pursue your research expedition. At WHOI, we've been assigning rank by level of likelihood, as well as severity of consequence. And then we reevaluate once we apply the mitigation step. The four major risk categories that you should be sure to include are going to be anything pertaining to medical policy, such as testing, self-isolation, do you have to do any temperature reporting? Also, what's the difference between what happens on shore ahead of your cruise and what happens on the ship? You'll want to be looking at your cruise logistics, such as any travel that's needed, the pandemic status of the place that you are traveling to, your science party, how many people can you actually bring? And is your equipment going to be ready? Is it going to be delivered on time? And then, of course, vessel operations. So not only standard policies that are always in place for any cruise, but what has been added to potentially help manage any COVID-19 outbreaks. What are the cleaning protocols, social distancing aboard, and then also very importantly, how is the crew staying safe between cruises as well as during a cruise? So as you're going through this process, you'll be inevitably collecting many different resources and creating lots of documents. These are all things that your stakeholders may be interested in reviewing before you're given a blessing or permission to conduct your cruise. And whoever that approving party is that will drive what your document needs may be. So this is an example of different documents that we have provided in previous situations. Now, going into specific questions to ask, considerations for your cruise planning. First, you want to understand your host vessel protocols. And all of you might not be going on a UNOLS vessel. You might be going on a charter vessel or a foreign ship. So you want to make sure you understand those. Pre-screening, who is on your science team? And are there any health risks that pre-exist that would make somebody more at risk? And is it worth bringing them on your cruise if that risk is significant? You also want to consider just the emotional comfort level of who you are asking to go to sea with you. And really importantly, we'll hit on this many times, but you'll want to start considering alternates. Because as you are going through testing and self-isolation, if somebody who's essential to your team gets sick, you'll want to have somebody else lined up to step right in. So with testing and self-isolation, questions that you might want to ask is what testing is available and to what extent, and on what kind of timeline? And can your team self-isolate? Does this require travel ahead of time to isolate in your origin port? And what's the duration of that isolation plan? Every operator will have probably very slightly different plans. So don't make any assumptions, make sure you ask. For monitoring, again, something that's going to be very specific to different groups. What is the self-monitoring and reporting that's going to be done before you're given permission to board? And then, of course, again, mitigation. What happens if a key person cannot sail? And that's, again, where your alternate is going to be coming in really key. Now, all of this will have implications for what your science mission can be. Are your ports changed? Does this cause your cruise length to be altered or your days on site to be altered? Do you end up deciding to scale back your science mission or merge with a different team to accomplish more with fewer people? What about your ancillary science objectives? Can you still support those if, say, you have to have fewer people aboard the ship? Will your instruments and equipment be ready? We know that some instrument manufacturers have had their doors shut, so can you get those shipments in time for you to sail? Is telepresence an option? And on what scale? What scale do you need as a scientist? And what scale is available from your vessel? We all know telepresence can be pretty broad. It can be, a quick Zoom call with a classroom on shore, but it can also be HD streaming footage from an ROV on the seafloor, 24 hours a day. So it can be very broad, and identifying what you need will be key. Also, can all of your critical team members sail? If your deck chief, who does all of the mooring deployments, can't sail at the last minute, do you have somebody that can step in and be an alternate? You'll want to lay out a plan listing all of these priorities, an expected schedule for the entire time period leading up to your cruise, your operational recommendations, and your safety requirements. This will be really important for you at your host institution. So for WHOI scientists, you want to put this together so when you speak to your host vessel or host operator, you can make sure that the WHOI requirements are being discussed. And vice versa. We want outside scientists to be doing this for setting expectations with us at WHOI as an operator. And again, make it a living document and share it with your whole team to make sure communication is smooth. For mobilization and demobilization and travel, your institution and your operator policies are going to be key here. Home versus host. Can you reconcile any differences between the two? What are the vessel specific needs? And what are the facility access limitations? So if you are used to going to the same facility, are you able to use the warehouse that you've used every year in the past, or is that no longer open to outside people? Things like that. Are there any dock limitations? Are you allowed to come and go from the ship as you please, or once you're on, do you have to stay on? For travel challenges and logistics, you'll want to consider, your foreign versus domestic travel and what that means for your routing. Can you get a direct flight, or do you have to make a 3-leg journey with hotels in between? And then, of course, the very current guidelines for federal, state, and local for sheltering in place. We've all seen that these have changed sometimes on a daily basis, sometimes on a weekly basis. So keeping on top of that will be helpful. And then if you start seeing that your expenses associated with your cruise, especially for your logistics and travel challenges, reach out to your program managers and find out if there is any supplemental funding opportunity to help you travel more safely. With the integration of the science with the ship, your shipping and loading logistics to minimize contamination is really going to be important as well. Can you get things there well ahead of time so they can be wiped down? Can they sit in the sun for a week? Things like that. Now, for being on the vessel at sea, first and foremost, we just want to kindly remind everyone that when you're at sea, the master is the legally responsible party for keeping everyone safe and for keeping the vessel safe. So that being said, as a science party member, you should always feel empowered to speak up to the captain or to somebody else aboard if you ever feel that there is something unsafe happening. But ultimately, it goes to the captain for the final decision making. So questions that you'll want to consider for what's going on with the vessel is, does the ship have a standard medical and safety response plan? UNOLS vessels do, but your charter vessel may not. How many trained medical officers are on board? Is there a shoreside medical provider? What mitigation steps have been made for a response to COVID-19? What if somebody aboard gets sick? What will happen then? Is there a social isolation plan that's just standard for every day? How will the ship be cleaned, on a daily basis versus between cruises? Meal prep and galley procedures are definitely a tough one. So you'll want to know what those are. And again, your workspace and your common space distancing plans. So do you really need to titrate with 2 people shoulder to shoulder, or can you have 6-foot distance? How can you set up your labs to be safest? But also identifying places where that's just not possible will be important. Every institution will have a slightly different approach. Here we've put up just a couple. So you'll see Scripps, University of Washington, NOAA, NSF, the Coast Guard with the Healy, and the Sekuliak with Alaska Fairbanks. So everybody has a slightly different approach. Here's just a smattering. We have examples of the Polar Stern and the Mosaic Arctic Cruise. Testing. They really went way above and beyond with their testing abilities and based on where they are. Whereas the Healy had a totally different approach, and ultimately the science party didn't agree that they felt it was safe enough. So there was a cruise that was canceled, and now they're reassessing. As for UNOL scheduling in 2020 and 2021, for 2020, US ports are the remainder for the year. If you had a cruise that was going to be foreign, know that now schedules are being reworked to have your start and end be in a US port. All of the UNOL schedules are starting to be redrafted and resubmitted right now. So if you haven't gotten an update, you will soon. And for 2021, know that foreign port calls still are off the table, but things change every day. So just stay flexible, and your schedulers really appreciate not only your input, but your understanding. Now for some quick case studies. As Rob said, we have sent the Atlantis successfully from Hui to Anacortes, Washington, but it was not without much discussion ahead of time. So that particular case, we had a 30-day transit with 21 crew and 2 techs. And the risks were identified as 1 high, we had 14 medium and 10 low. To help mitigate those risks, we altered the transit plan to stay as close to shore as possible. We identified refuge ports. We closely monitored the Panama Canal status. And then once we had gone through that whole process, we reached out to the Hui Senior Administration for approval, and then ONR and NSF for the blessing and approval to go on the voyage. And as Rob mentioned, we successfully landed in Anacortes in mid-May. Now, for the first science cruise that we are approaching, that would be OOI Pioneer. And the initial situation for that cruise was that Pioneer had a lot of mooring turnarounds that had to be conducted as sufficiently low risk as possible. Initially, the scope was always going to be Hui to Hui, but it was a 21-day cruise with 2 different legs, with 42 people aboard, 16 of which were science, and multiple non-local participants. So initially, the risks were pretty significant. We had 20 high, 16 medium, and 0 low risks. Then we went through an extensive effort among stakeholders to develop the mitigation plans that spanned pre-cruise preparation through onboarding procedures. We were able to reduce the scope of the mission to being only 11 days. We reduced the science party almost by half. We're now sailing with 9 scientists, and 2 of the folks aboard are non-local. Between the mitigation efforts and the reduction of scope, we were able to mitigate the risks down to no longer having any high risk, 14 medium risks, and 21 low. And we are in the final stages right now of getting the approval to sail on this cruise almost a week from now. For Tioga users, we have been operating the Tioga since late March, doing mostly AUV and glider ops and some CTDs. We are limiting the science party aboard to 3 people. You need to bring all your own PPE, all your own lunches and drinks and snacks. While you're aboard, you need to remain socially distant, and this includes not entering the wheelhouse. That is off limits. Then between each mission, the vessel is fully sanitized. So we have some time buffered between this in the schedule for that. As with coming into the office at Hui, you have your daily assessments that will be required. And if you have any other questions specific to Tioga, feel free to reach out to Eric Benway or Peter Collins. Now, if you are a visiting vessel that is coming to Hui, there's a standard schedule that needs to happen, which you usually would talk to Carrie Strom about. There are a few new items on that. You need to discuss with your supervisor and make sure permission has been granted. And then lists. These are big. You're going to need lists of your science party, your mobilization team, any vendors that are going to be coming and going, because they all will need to fill out those forms that we need to fill out daily to come into the office. And your load plan will be really important to know in advance too, but that's mostly for dock maintenance reasons. And then the reporting and the safety sections are entirely new. So with that, that wraps up the meat of what we have here. We have a whole slew of panelists. As you can see, we have Rob Munier, Kathy Benjamin from HR, Al Pluteman is representing the science community. And then we have a whole bunch of folks from Marine Ops. So Tim Toomey, Eric Benway, Pam Clark, Captains Derek Bergeron and Kent Cheesley, as well as Carrie Strom and Kim from the charter vessel group. So without further ado, we are going to proceed with the pre-submitted questions, and I will farm those out to different members of the panel. And then once we get through those pre-questions, we'll then solicit for you all to submit any additional ones you may have created while listening to this presentation. So just give me a moment. All right. So panelists, when you are called, if you would please put on your video so we can see you speaking, that would be wonderful. So the first couple of questions are going to be specifically for Kathy Benjamin as they revolve around testing and self-isolation. So Kathy, are you there?
I am here.
Great. Thanks,
Can
Kathy.
you see me? Okay.
All right. So first off, a question submitted was, we've heard that testing is required before going back to sea, but does that mean we should also be testing before coming into the office or into shore labs?
So the answer to the question about do we have to get tested before coming back into the office after a cruise, and the answer is no. No testing is required before coming back into the office. The institution develops a protocol specific to each cruise that is comprised of several steps that Sarah mentioned. Pre-screening is one of them. Currently, we have 2 testing gates with daily online self-assessments for symptoms and 2 phases of self-isolation. This is based on our most recent UNOS guidance, and particularly the one I mentioned is relative to our OOI Pioneer cruise. So every day, our response team here at the institution is monitoring updates and developments in the medical community, and our guidance could change, but that's our answer at this time. Thank you.
Great. Thanks, Kathy. We have a bunch more for you, so don't go anywhere.
Okay.
If you travel to board another ship and testing is done there, but you test positive, what support from WHOI exists?
So that's a really good question. If you board another ship, they will have their protocols in place to follow. And just like with our captains, their captain will be in charge of what happens on board when that happens. Ship operations here at WHOI work with, they will keep coronavirus, which is what our response team is called, informed, but we'll be working in close collaboration with them. But ship operations would be working, they should be contacted as soon as possible so we could coordinate the situation, and then we'll determine the resources that are appropriate to respond.
Great, thanks, Kathy. What about the differences between medical insurance or workers' comp for that type of situation?
Well, I think the situation that's being asked is if we get an illness when we're on board a vessel, what kind of support are we going to have for the costs associated with that? And, you know, the institution has a variety of insurance policies that it depends on regularly, but it depends on what the situation is. For instance, our marine crew is covered by P&I insurance, where we also have workers' compensation for our WHOI employees, and our WHOI employees might have medical insurance that might be under our plan, or it might be under somebody else's. So no matter what the situation is, WHOI employees are protected with coverage, and we would coordinate it based on the circumstances.
All right, so no matter what your circumstance, they'll be reaching out to you if that happens.
Yes, and we'll be coordinating it. It won't be just with me. We'll be coordinating it from a lot of different directions.
Great. And then there are a couple of questions about hotel support and per diem work, both before you travel to the vessel or before you load onto the vessel, and then also when you get off. So is there any support from WHOI as an institution for that need, or is it a project cost?
Typically, this would be a project cost.
Okay, great. And any comments about there's all of this preparation for boarding a vessel? How about getting off the vessel and traveling home?
Well, you know, people always have a variety of circumstances. They might be picked up at the airport. They may be driving a rental car from an airport. They may have left their car at the airport. So all of those circumstances are different. And then what they're going home to might be different. So one of the questions I think someone asks is, do we have self-isolation steps that are required after getting off of a cruise that does not end in Woods Hole? And we do not have self-isolation requirements at all. And, you know, everybody has to take an assessment of what their circumstances are and use all of the smart guidance that is out there. Wearing a mask at all times, doing physical distancing, thinking of cleanliness protocols, and then assessing the risks that might be at home, whether they have risk individuals, talking to their own personal physician, you know, their PCP, and getting as much input about their individual circumstances.
That is a perfect segue into the next question. What happens if you have a high-risk person in your home that you need to be considering? Is anything different there?
No, I think the biggest thing is to get input from that person's physician in regards to the situation, and perhaps even your own physician as you're returning. Medical personnel will be the best ones to evaluate what the current situation is for you.
Great, thanks, Kathy. Two more quick questions for you. Is WHOI providing any PPE for people that are traveling to the ship? So not necessarily aboard the vessel, but traveling to a vessel.
Well, first of all, our EH&S department that's led by Ron Reif has developed protocols as every step of the way we have been working back towards our transition. And I know in particular that Ron, for our cruises, he has N95 respirators that are reserved somewhat for Armstrong. But he's the one who people who are interested should be reached out to directly. The captain will be issued the N95s, and they coordinate with, in this case, Ron Reif. Ron actually goes through a discussion with an individual. He goes through what we call a hazard analysis. And I will say that, you know, they have arranged for our stockroom to be equipped with N95 respirators as well as ear loop masks. And so Ron and the captain and the ship ops will coordinate all of that.
Okay, but that's specifically for being aboard the vessel, not for traveling to a different vessel.
Correct.
All right. So, and the last question we have for you is, are there any suggestions for limiting exposure for getting to and from airports? Is there any extra institutional support for green shuttle or private car services to avoid public transport?
So first of all, most staff have their own cars available to get to the airport, and they should do so to minimize contact. If someone does not own a car and cannot get a family member to drive them to the airport, they should reach out and speak directly with their department, their supervisor, to think through what other options there are. But at an institution level, that is not something that that we need to get involved with, because it's usually figured out at that level. But we will always be there to help with guidance.
Great. Thank you, Kathy. I'm sure there will be some other questions for you down the line, but let us switch over to some ship-specific questions. So Kent and Eric, if you wouldn't mind visually joining us. All right, so Eric Benwick, again, is the port captain for WHOI, and Kent Cheesley is the captain of the Armstrong. So Kent, we'll pose this to you first. What happens if a science party or crew member gets sick at sea, and what happens if they need to get off the ship and go home?
Yeah, so I can go ahead, Sarah. When a person gets sick at sea, all operators and captains have a procedure, have a policy for their own safety management system. So it's already there for WHOI. We've had it for years. We do update it. So there is specific steps that the captain and the medical officers take along with the port office. So we do that, and along in conjunction with that, the UNOLS fleet, if you're on a UNOLS ship, has contracted with George Washington Marine Medical Services, and they are at onshore medical provider 24 hours a day, every day of the year. So our captains and medical officers are guided by George Washington doctors ashore, and those are the steps that we will take. How do they get off the ship will depend on the condition of the patient and what port regulations or restrictions are in place. We could use our small boat, or Coast Guard may have send out a boat. It could vary in any direction, but those are questions that everyone should be asking your cruise planner or ship operator that you're going to be sailing with. And they shouldn't be too hard. You know, the policy at sea, if someone gets sick, that shouldn't be a real hard, difficult one for them to answer. But the how do they get off the ship question, that can be an open-ended, you know, that can depend on a lot of factors and region, locales, and things like that.
Thanks, Eric. Kent, do you have anything that you would like to add?
Nope, that about covered it. It's again one of those important questions to feel comfortable with when you're talking to the operator that you're, you know, whoever's operating the vessel you're going to. It's a comfort zone thing that they're prepared and have a plan, as Eric laid out.
Great. Now, what would happen, Kent, maybe this can go to you again. What happens if you are at sea and a loved one at home gets really sick or has an emergency? What typically happens in situations like that?
This is a very, very difficult thing to answer because it's not a very nice one. But generally, you know, historically, you really need to be comfortable with the sacrifice of time going to sea. It has happened in the past where we've dropped somebody off who had an issue at home, but very rarely. But it really is situational. The default I would expect you to, or I would suggest that you expect the default to be you won't be getting off the vessel. There is a lot of outfall. There's a lot of complications with that, and the reality right now with the COVID situation is, by the time you get home, things are, you know, you're talking several days, depending on how far offshore you are, if not longer. And when you get home, are you going to be able to actually be in touch with your family member? So what's the difference of being on the ship or being, you know, at the house? We can, I would suggest that whatever ship you're on, you can ask them to help you out with good video chat, you know, Zoom or Skype or whatever, so that you can be in contact. But typically, unless there's a really good reason, we don't justify dropping somebody off.
Thanks, Kent. Building a little bit off of this, we have had a question that was just written in, and I want to open up the floor for people to start writing in those questions. But one that just came in is, what kind of considerations are being given as per the UNO's guideline to adding medical professionals or medical officers aboard? How is that approached? Eric, do you want to take that?
Yeah, so that's a good question, and it's up to the science party's comfort level and the operator's skill and training of the officers on board who are medically trained. Now, some smaller outfits or operators may have one person and no backup, or they may not have anyone who's fully trained to go to longer at sea. In our case, we usually have at least 2 on board, medically trained care providers. But again, everybody would be working through George Washington Medical and guided that way through telemedicine. But it's a very good question, and one that all operators should consider, along with the science party, especially to waters beyond U.S. ports, to faraway places where options are not readily available, like days away. So that's a good question, and that all operators should be aware of.
Thank you. How about what extra precautions are being taken specifically for Hui in this case, for going further offshore, as in more than a few days away from the closest port?
Yeah, so, you know, again, we've got to keep it in general terms, but this would be, the operator should be disclosing this information to the science party, and science party in turn also should be asking the operator. In our case, as just an example, we would make sure we have additional PPEs, a fully stocked hospital, which we always do, but we would certainly, maybe if we can get extra supplies, we would. Oxygen, of course, but also extra fuel and provisions should we need to go to a refuge port and we are held for, a week or more. We need to make sure that we have the adequate supply of food and, all of that, which we would do. We also notify our P&I insurance companies. So they are tremendous support if we have to have a medical evac and have to go to a refuge port. They offer a very good support system. Also, we give advance notice to all of our ship agents to the refuge ports along the way, along the route to and back, or if it's one way. So we get advance notifications of any port restrictions or regulations and reporting authorities. So, it's really just doing advanced scout work is the big part of that, and making sure that we're fully stocked with medicines and PPEs and fuel and food.
Great, thank you. We have a couple more shipboard medical questions, so I'll keep you two here for a moment longer. Does PPE need to be worn all the time for the entire duration of the cruise, or do you reduce the needing to wear masks, etc., after being at sea for 14 days?
I saw that from Heather earlier, and I'll just give my 2 cents, and I'll let Kent chime in. It could be possible. Depends on the health, of course, of everyone on board, and if everything has gone well for 14 days. It is up to, really the captain and making sure the science party is all comfortable with the decision. But then if that happens, if there's no mask or cloth mask required, but other protocols may be put in place to keep everybody assured, like temperatures being taken once or twice a day, things like that. It's possible, but I wouldn't say it would be a given or, a standard practice. Captain, anything?
Yeah, I think the answer there you stated was there's got to be a significant comfort level with everybody on board. A lot of the things that we've just been experiencing in gearing up for both the Atlantis and the Armstrong getting underway, the theme, one of the themes that kept coming up, rightfully so, in this era of a virus we still are learning about, is how uncomfortable everybody is with this. And so you can have people on high making decisions. Oh yes, we don't need any more PP, or we don't need this, or we need to do that. But I think it's still important for us as a community to continue to support the idea that everybody on the boat really needs to be comfortable. So I would suggest if we get to a level where testing is more prolific and happening, and things are settled out quite a bit, and then of course that 14 days on board has already happened. Yeah, it might be worth a discussion with everybody on board, starting with the seniors, on going in that direction. But if there's any kind of uncomfort with that, I would suggest we stick to the conservative approach.
And Kent, could you describe, I guess maybe in general terms, or maybe specific to the Armstrong, with you as captain, what would happen if somebody aboard came down with COVID? What's an example of a type of plan that you would put in place?
Okay, so the broad strokes of the Armstrong's plan, for instance, are the biggest priority, initial reaction is going to be isolation, right? Trying to minimize any sort of spread. So isolation is the first step. Science party has adjusted their plan to accommodate our wanting to have that protocol, so that, hence the reduced crew science party size. So we have a pretty strong isolation plan kind of ready to go. And that includes how somebody eats, how somebody uses the restroom, how somebody, the whole big picture, as well as the medical care provider now really needs to isolate as well, because you need somebody taking care of them in proper PPE, of course, to protect themselves. But then that person, that medical provider, what we call med pick or, ship's medic, is effectively also needing to go into isolation, so the isolation part is the first step. And then from there, as was noted in the slide and Eric mentioned, we're in immediate contact with George Washington Medical to work this out as safely as we can for everybody on board, the patient and everybody else as well. I hope that answers the question. If not, let me know.
It does. There are lots of building questions here. So what about air circulation on the ship? Is there a way that you can isolate that to prevent circulation between cabin spaces or?
Well, that's ship specific. I can tell you it's not that easy to do. That's a challenge. That's one of the very big challenges with this particular type of a potential shipboard illness that can go through quickly. In our case, we can isolate the ventilation system mostly. So we would have to do some other things to try to mitigate where we can't isolate the ventilation. We can't, isolate a room's airflow. So that was given thought when we came up with our plan. A good question for the operator. If you're, as a scientist going to another ship, it's definitely a fantastic question to ask.
Thank you, Kent and Eric. We are going to give you to a break just for a moment. Al Pluteman, I have one for you.
Okay.
So you have experience as a chief scientist going through this whole process with us at WHOI. So what has been your experience for bringing non-local cruise participants to our ship? And what do they do after they arrive on a domestic flight, things like that?
Right. So the very first thing we did was try to minimize that. We actually thought we were going to eliminate that, but that wasn't possible. So it probably isn't possible for everyone. So we had a small number. I think we were down to 2 for the info on your slide there that were non-local. And they are really maybe oversimplifying it, but basically they're going through the exact same protocol as everyone else in the science party. So they need to be here 14 or 15 days ahead of time. They start with a COVID test procedure. They then go into their, isolation protocol. They continue through that, have a second test, and go directly from isolation onto the ship. So in terms of conceptually, they're doing exactly what everyone else in the science party is doing. In terms of the details, it's a little different, right? So they're at a hotel, say, they're not, not at their home. They're getting meals, they're getting delivery service of some kind. They're not going out to nobody's going out to restaurants right now, but they're not going out in public. And finally, I think you alluded to this, or it was one of the questions that Kathy answered. As the science project, we're bearing the cost of that, lodging and per diem. So there are additional costs with running a project like this through the COVID protocols that are not normal. And this is where you want to talk to your program managers, or, part of what we did, it was not really something we wanted to do, but the result was the cruise was de-scoped, as you mentioned, for the Pioneer cruise. So the total scope of the cruise was reduced. That actually made some funds available to do these things like, provide for isolation and lodging and per diem. So, and I guess the final comment is just, it's a case-by-case basis. You really need to talk to every individual, find out where they're coming from, what their situation is, what their issues are. You can't, there are broad concepts, but there's not really a cookie cutter protocol. It's got to be handled on a case-by-case basis.
Right. And maybe you can also help shed a little bit of clarification on your perspective of wearing PPE aboard the vessel. So for Pioneer, how is your team approaching that aboard?
We plan to use masks pretty much 100% of the time when we're outside of our stateroom. That includes in the lab, the big lab room that includes out on deck. There could be situations where the social distancing capability is so obvious that maybe you don't need, you're 25 feet away, you're by yourself for 20 minutes on the back of the deck. You shouldn't be by yourself on the back deck anyway, but there could be some rare cases where it's not absolutely essential, but really, I think I'm pretty much on board the same thing Kent is saying. The default is we're wearing masks all the time. It's just, you start to make exceptions, it gets very complicated. So the simple answer is outside the bunk rooms, we're going to have our PPE. We'll certainly wear gloves when warranted, but I don't see that as a standard 24/7 with gloves on, but the masks, yes.
And do you envision having anybody on your science team specifically monitoring the other members of your group to make sure that everybody's complying, or are you sticking with the honor system?
Yeah, we will be talking about it regularly, but we will not be specifically monitoring. I don't plan to specifically monitor. There's some advantages of this really small science party. I'll probably pretty much see everyone almost all the time. So I don't see that as a big problem, but for a more complex cruise with a larger party, yeah, it could be that you want to have kind of the watch leader, or, the person who's, you want to have someone who's going to be around during each operation to just keep an eye on things. It probably is pretty much in the standard realm of what a chief scientist or a watch party leader would do anyway in terms of overall safety and quality of the operation. But now we have a little added, some added issues in terms of PPE.
Great. Thank you so much, Al. We are going to go back to Kathy. So Kathy, if you wouldn't mind popping back up for us. We have a few logistical questions for you. If you're out at sea on a non-HUI vessel and somebody contracts COVID-19 while you're out there, is there any support for when the ship returns to port for testing? Is that something that HUI would do? Is that something that you would want the host vessel to be doing? And also, is there any required self-quarantine as a HUI employee when you come home?
Those are really good questions, and we would work through ship operations and collaboration with our response team and with me specifically. We'd be working through all of those issues because it depends on the port, it depends on what the protocols are for the vessel. But the biggest thing is we're there to support our employees, and we'll be doing that because we're just not sure what will happen, and there's a lot of different scenarios that could occur.
Thanks. And then for folks that are, have a last minute trip that they're being called upon to go out and support equipment that's on a vessel, on the other side of the world, something like that, are they able to get tested by HUI here ahead of going on that expedition to go repair equipment that's far away?
Well, one thing that we've done already in the anticipation with a colleague, it was actually with URI. It was HUI-based employees, but they were going through URI cruise, and we provided them with all the contact information to make sure that they were set up in advance, and if they needed testing to be done, that it could be done locally. So they set up an account themselves, and because the activity is being directed through a different vessel and a different set of operations for a cruise, that seemed to be the most effective way to do it. And there might be other scenarios out there again, and we'll have to take care of them as we encounter them.
Great. Thank you, Kathy. And then what happens if a HUI employee contracts COVID-19 as a direct result of participation in a cruise? Are they eligible to have healthcare costs compensated under workman's comp?
Oh, I thought we already answered that question. Yes, we have workers' compensation insurance, and this is an illness. So just like any other illness that happens, the captain is in charge of determining what the best course of action is immediately. And then they engage with our risk team here, shoreside, to make sure that the right approach is taken for, taking care of all of those concerns so the person can focus on getting better.
Thank you. And then maybe just some clarification on how we are doing testing before getting on a WHOI vessel. So somebody is coming from a different community where testing is not available, but they may be joining a WHOI vessel. How are we approaching that?
That would be great, because we actually that Al Plutman arranged to come in from the UNOLS tech pool. So that person flew in more than 14 days in advance and then joined the 14-day process. Because it was part of Al's cruise, we attached that person and provided the testing authorization. So we took care of that, those arrangements. And that person had to follow the same protocol that all of our employees were for that cruise.
Okay, great. And then, sorry to jump back and forth, but back to workman's compensation. How does that work for students or for postdocs that are not full-fledged employees?
Students and postdocs are not covered by workers' compensation insurance, so they would be covered by their medical insurance.
Thanks. And then maybe this.
I would say postdoc investigators are employees. Postdoc scholars and postdoc fellows have separate insurance.
Thank you. And then I have a question about air filters. So maybe Eric Benway or Kent Cheesley, you can chime in on this. Is there an ability to have higher efficiency filters aboard the vessels? So HVAC filters, MERV rated filters, anything like that? Do you have that flexibility aboard to upgrade your filters?
Well, yeah, we have the ability to add some filters on the intakes, but our system isn't an in-house recirc system. It's kind of a one pass-through. That actually makes it easier for us for the question earlier about isolating the ventilation system. So yeah, that's a great point about filtering, adding additional filtering for the appropriate ratings. But it's ship specific on if it's a recirc system, if it's a one pass system. So in our case, we can add some stuff to the intakes, but it doesn't help us on the recirc part.
Great, thanks, Kent. There's a quick question about, who to contact about certain things. If you have anything that is directly related to health or testing or self-isolation, the coronavirus Q&A email address is where you will want to pose those questions specifically, so that team can then evaluate them and get back to you on your individual bases. So I think that covers the vast majority of the questions that have been submitted. I want to again thank everyone for your time today. I'm sure this has raised more questions for you than it might have answered. But again, the real take-home message here is to go through your risk assessments, identify those risks, and try to mitigate them, no matter whose vessel you're sailing on. So get your teams together, and the earlier you can start that process, the better. Just keep in mind that if your cruise is later in the year, your vessel operator may be scrambling to get one that's imminent safely off of the dock. So just be kind and patient and be diligent. So thank you everyone for your input and listening. This has been recorded and we will be posting the slides as well as this recording and any potential questions up to a place on the website, and we will send out an announcement of exactly where that ends up. So thank you again, everyone, and have a lovely remainder of your Friday.